Aha. Daniel. Daniel?
Yes.
It appears that there are many people in the waiting room. Can you
I have just
let them?
admitted all, yes.
So, okay, there is quite okay. Then sollte es bei dir gehen. Okay. Yes, now I also see that the recording is on. Okay, let's wait another minute or two.
Jörg, you can hear me?
Yes.
What seems to happen is that each time somebody wants to join, I have to click an admit button, which is not so comfortable because I have to join another meeting, as you know, while this webinar will be ongoing.
I think that, sorry if I interrupt, I think that Jörg should also be able to admit people since he is...
Okay.
That would be great if you can take over this task. That will be helpful for all.
So Jörg, if there is, you will see a small message that says
Popping
people
up
are in the waiting line, and then you can admit them. I don't know if we can test whether this is possible.
Well, there is one right now, and I don't click. Can you click, please, Jörg?
Yes.
You did, huh? It
yes,
disappeared.
it works. Great.
So we have solved that little technical issue. Great.
Great.
Should we start?
Yes, please. Daniel.
Excellent. I see 16 participants. I will say hello to everybody. My name is Daniel Maselli. I work at the Swiss Agency for Development and Cooperation, SDC, where I am responsible as the focal point for the Climate Change and Environment Network, who has been organizing this webinar on the World Bank report Unbreakable, and we are being supported by our backstopper Infras. I see that there are quite a number of people. I assume you are in different time zones and places all over the world, so it's either good morning, good afternoon, or good evening. But in any case, it's great that we have the opportunity to listen now to Stephane Hallegate, who will present us this report Unbreakable. Without further ado, I hand over to you, Stephane, so that we can actually profit most from your time, which you are putting at our disposal.
Sorry, there are a few technical things.
Yes, I hand over first to you. I apologize.
Yes, this is Jörg Füßler. Also, hello from my side. I'm working at Infras, and I will moderate this presentation from Stephane Hallegate. A few technical points. So first, make sure that you see the screen on your web browser. You should see a slide saying Unbreakable. If not, there are small there's a small screen icon that you may want to use to see the screen. Secondly, please mute yourself if you are not speaking. This improves sound quality. And you may use the chat window anytime, but then particularly later in the question and answer session. And this webinar will be recorded for people who cannot attend and later put on the website. So I'm very pleased to host this webinar today on the World Bank's Global Facility for Disaster Risk Reduction's Unbreakable report, Building the Resilience of the Poor in the Face of Natural Disasters. This is a central topic also of the SDC's global program on climate change and environment, and I'm very happy that Stephane Hallegate took the time to hold that webinar. He's lead economist with the GFDRR at the World Bank. He joined the World Bank 5 years ago after 10 years working in academia, including Météo France and Stanford, and he holds many degrees, one in engineering, but also in meteorology and climatology, and on top of that, a PhD in economics, a perfect mix for the difficult questions at hand. So with that, I would like to hand over to Stephane. The floor is yours.
Thank you very much, and thank you for the invitation to make this webinar. It's a great opportunity to discuss our work. And I also should say welcome in my kitchen. The World Bank is closed today because of a snowstorm, so I'm doing that from home. My daughter is around, so she might decide to make comments during my presentation. Hopefully we'll have no technical issues during this presentation, but apologies in advance if it happens. I would like to start by saying a couple of words about this report itself, saying that it's really part of our work trying to look at this question of natural disasters and resilience, and also climate change, which is part of the question, and trying to move from the kind of like political statements that and advocacy that we were doing a few years ago, saying this is an important issue, towards something which is much more operational, trying to guide our teams and everybody working in countries to identify low-hanging fruits and opportunities for action. So we really hope that this work can really support also your work and your operational work. And I have to say, since we're now designing the next phase, the feedback that you can give us on what's useful and what's not, and what you would like to see in a second round could be very, very useful at that stage, because it can really have an influence on what we will do in the next few years. So I'm really looking forward to the discussion and your comments. Before I get into the content, let me start with some motivation for this work. And for this motivation, the best is maybe to start with a little illustrative example. Let's assume that you have on your desk 2 coastal protection projects. You have these 2 pictures on your screen, 2 dikes, very similar ones, and your budget allows to fund only one of them. And the question is, which one is the best? So the traditional way of doing that is to look at the costs and the benefits from the projects. So this is what you're doing, and your analysis tells you that the project A on the left costs 100 million, and every year it prevents about 20 million of losses every year. So pretty good investment. Project B, same costs, but on average it prevents only 5 million in losses every year. So when you look at that, it's a no-brainer, right? Project A is better, so this is what you should invest, same cost but higher benefits. But then before you sign all of the paperwork, you're going to do a field visit, and behind the dike in Project A, you find fancy neighborhoods with beautiful houses and Maserati cars, a lot of very high-value assets, and protecting high-value assets, of course, brings you these very high benefits from the dike. Project B, you find an informal settlement. This is Dharavi in Mumbai. A lot of people, but they are so poor and they have very little assets, which means that the value that you protect is not so high, so the benefit is much lower. So with the mandate that we have at the World Bank and that we have in development of reducing poverty, of course, when we look at these pictures, you think, okay, maybe the economic benefits don't tell the full story. It's not only about how much benefits I'm creating, but I would also like to take into account who are the beneficiaries and what it means, 5 million for the people living in a slum versus 20 million for people living in a fancy neighborhood. So this is what we're trying to do with this report, to try to help think about the priorities, taking into account also who are the beneficiaries and what the protection means for their livelihoods and their everyday quality of life. We're doing that by starting from the very traditional risk assessment. So maybe you're already familiar with those concepts, but if anybody doing risk assessments always talks about first what we call the hazard, which is the physical event, so an earthquake, a storm, a flood, but described as a physical event happening. The second concept is the exposure, which is the population and the assets that will be affected by the storm or the earthquake. And the third block is the vulnerability. So when this population is affected by this physical event, how much is lost? And a risk assessment like that helps us assess the asset losses. So when Hurricane Matthew made landfall on Haiti last fall, and the newspapers the next day had this title, like Hurricane Matthew caused $2 billion in losses in Haiti, these 2 billion losses are the loss of assets. So the value of what has been damaged and destroyed. What it doesn't tell you is what it means for the affected population. What it means $2 billion in losses in Haiti. And of course you see that the number is not enough because 2 billions will mean very different things in Haiti and in New York City. So what we're trying to do in this book is to add a fourth block, which we call socioeconomic resilience, even though there are many different words that we could use. It's also a socioeconomic capacity, for instance. And what we describe here is the ability of the population being affected to cope with the asset losses and to recover from them. So not only the value of what has been damaged and destroyed, but what it means for the population in terms of impact on their well-being and how difficult or easy it will be for them to recover. And by adding this fourth block, what we're trying to do is to assess not only the asset losses, but what we call the well-being losses, which tries to better describe what happens to people. So being a bit less abstract and aggregated, but looking at what happens for households and individuals and their well-being. So this is the philosophy of this book that we apply on this issue. By doing that, we reach three main messages. What I will do now is to go through these three main messages relatively briefly, and then we can discuss more. The first message we reach in this book is maybe the most important, and that's when we do disaster risk reduction, we're doing poverty reduction, and when we're doing poverty reduction, we're doing disaster risk reduction. So these two goals, these two agendas, poverty reduction and disaster risk reduction, which are very often managed in countries by different agencies, different ministries, there are different communities working on them. What we show in this book is that these two agendas are very much aligned and that they can really contribute to each other very much. So there's not so much of a trade-off deciding if we want to focus more resources on risk on poverty. There are a lot of synergies. How do we reach this conclusion? First, we show that the fact that people are in poverty, that many people live in poverty, explains why we see these disasters every year and all of these disaster losses. So we show that poverty is one of the drivers of disaster losses. We do that by using the framework I just described with hazard, exposure, vulnerability, and resilience, looking at the effect of poverty on these different blocks. So the hazard, an earthquake or a storm doesn't care if you're poor or rich. So this component is not affected by poverty. But as soon as you look at the exposure, you can see how poverty contributes to exposure. So the typical example is the population moving to cities to capture opportunities and better jobs and services and schools. When they move to cities, they have to find land that's available and cheap and well connected to jobs and services. And in most places, land that is like that is land that nobody else wants. And in many cases, it's because of risk level, for instance, floods. So people moving to cities because they are poor and because they cannot choose where they live and they cannot afford to live far from jobs and services, they have to accept to live in poor places. So the exposure that we find, especially in cities, is in large part due to the fact that people are living in poverty and have little choices. If we move to vulnerability, again, we find that poverty explains the vulnerability of the population. And here in the book, we look at two elements. One is the portfolio of poor people compared with the portfolio of richer ones. So most middle-class people, and I have a lot of my assets in financial forms. I have a bank account, and a bank account cannot be destroyed by a flood. So part of my wealth is protected because it's not in material form. Poor people have all of their wealth in material form. In cities, it's mostly the dwelling and what's in the home. In rural areas, it will be mostly livestock. So poor people have all of what they have potentially destroyed by a storm or flood or an earthquake. And even these material assets are more vulnerable for poor people. So one thing we're doing in the book is looking at the housing of poor people and richer people in more than 200 countries using an inventory of buildings. And we find that poor people, so the bottom 20% in countries, more than 3/4 of them are living in houses that cannot resist to any disaster. I mean, even like a small storm or a small flood would completely destroy their dwelling. So the fact that people are living in poverty means that not only all of their assets are in material form, but also these assets have a very low quality and can be wiped out very easily. So again, poverty here contributes to this vulnerability block. And finally, the last block, resilience. It looks like a no-brainer that poor people are less resilient. In the book, and I have to say, I'm going very quickly on these elements, but I hope you will have a look at the book, because for each of these blocks we have fairly in-depth analysis using a lot of different data to back our statements. So for instance, on socioeconomic resilience, we look at the fact, for instance, that poor people are more likely to have their friends and families living also in poverty, which means that their social networks cannot help them the same way it helps richer people cope with the shock. We also look at the access to borrowing, which is very useful to rebuild if you have suffered damages. But again, poor people don't have the same access to borrowing as richer people. And even social protection, which you would expect to be the tool that helps poor people. Well, if you look at very poor people in low-income countries, the coverage of social protection is very partial, and a lot of poor people are simply not covered. So the point we're making here is poor people suffer much more from these losses, and losses are increased by the fact that people live in poverty, because poverty increases exposure, makes poor people are more often affected than the rest. When they're affected, poor people are losing a larger share of their assets. And when they're affected, poor people are much more alone to cope with the shock and recover. So all of that combined explains why poor people are so much more vulnerable to these shocks. So this explains why in the book we have this link between poverty and disaster losses. But when it gets really difficult is that this is not a one-way street. This is a feedback loop. And also the poverty we see is partly explained by disaster losses. So here we review a lot of case studies showing that after disasters, poverty increases, and poverty in monetary terms, but also other indicators like child undernourishment or child labor increase after disasters. Because it's difficult to communicate on case studies, what we're doing also is to try to combine all of those case studies to assess how many people are falling in poverty every year because of disasters. And we find that 26 million people every year are falling in poverty because of earthquakes, storm surge, tsunami, windstorm, flood, and drought. And we stress something which I think is really, really important and sometimes confusing. The fact that if you look at earthquakes, storm surge, tsunami, and windstorm, they are the event on the left-hand side on the slide that you're looking at. Most of the impact on poverty is due to very infrequent events. So think of the Haiti earthquake. Disasters that do not happen very often, but when they do happen, it's a huge shock. And you can have millions of people falling in poverty at once. If you're looking at floods and droughts, the events that push people in poverty are not the big ones that we see on TV or in the newspapers. It's more the very frequent small-scale, little floods that happen every year in big cities in Asia, or the drought that happen every 2-3 years in Africa. So things that we don't talk about as much because it's smaller. We don't record these disasters very well because, again, they are not like in the news. But if we're interested in poverty, these very frequent events are really, really important. So as we will discuss disaster risk management, we have to think about two types of disasters we want to deal with: the frequent one and the exceptional one. And the same tools won't work for these two things. My second message is really like building on the first one, and that's when we look at disasters and their severity, we tend to look at their costs, but their cost in dollars is mostly looking at what happens to rich people, because they are the one losing a lot of dollars. So we have to find another type of estimate if we want to look at what happens to poor people. So this is what we're trying to do in this book. I won't get too much into the details, but just to give you a sense of how we do that. We start from the typical risk assessments to assess asset losses. And then we're looking at how these asset losses translate into income losses. And to do that, we have to also add a lot of new economic data in the analysis. So it's not only the typical risk assessment, but we have to bring new elements like whether income of people is diversified or if they have only one source of income, the link between assets and income, and the duration of the shock. So this we use to look at the impact on income, which is closer to what we want to look at, but not enough. So we also look at how these income losses translate into consumption losses. And here again, you have to think about new elements, like whether people are covered by social protection, whether they have savings and they can borrow to smooth the consumption losses, or whether they are insured or receive remittances. So we take all of these new components into account to look at how these asset losses that we focus on can translate into consumption. But even that is not what we want to look at, because think of people losing $200 in consumption. For people like me, it means cutting on non-essential consumption, going less to restaurants and buying less books or something like that. For poor people, cutting $200 in consumption will be done through reduced food intake, reduced education spending, or reduced access to healthcare. We have very strong evidence that the three basic consumptions, food, education, and health, have to be reduced when poor people are being affected. And the problem is cutting on these consumptions has long-term impact, especially on children. For instance, in Mexico, when a kid is taken out of school because of a shock, 30% of the cases, the kid will never go back. So the education is wiped out. It's not only a disaster that can last a few months, it's something that will last forever in the life of this kid. Same thing for food intake. It can have consequences on the development of children forever. So we want to take into account the fact that the type of consumption losses we're talking about is not the same for poor and non-poor people. And we do that by putting a different value to $1 of consumption losses affecting poor people compared with non-poor people. And by doing that, we try to assess well-being losses. So this is what we're doing. And that's how we calculate social economic resilience, this ratio of asset losses to well-being losses. And we do the analysis in 117 countries. Here what you see is dark colors are countries with low resilience and light colors countries with high resilience. By doing that, we measure how $1 in asset losses is affecting well-being in those different countries. These can be used to track progress over time. So if socioeconomic resilience increases, it means that people have better access to social protection and so on. And we plan to use that to check that development is contributing to resilience. Let me shift this to get to my third main message. So my second main message was that by looking at socioeconomic resilience, we can get a better sense of what it means to have a disaster affecting a country. Now what we're looking at is the value of building resilience in countries. And this is when we get to the more like action-oriented part of the book. What we show is that policies that make people more resilient can generate a lot of benefits, 100 billion a year globally. And how we do that? So the point we really wanted to make is that we need to reduce risk in the world with better infrastructure, better land use planning, and so on. But we have also to acknowledge that we won't be able to avoid all disasters. And we have in parallel to make sure when there is a disaster that we can't avoid, people can cope with it and recover. And the tools we're looking at to do that are presented on this slide. And we want to insist on the fact that it's not one silver bullet that will do it. We will need many different tools, some for poor people, some for richer people, some tools for small events, and some tools for big events. And only if countries have the full toolbox, they will be able to cope with disasters. So we find that revenue diversification is really useful for small disasters, but as disasters get bigger, people have to rely on savings and borrowing or market insurance. But these tools are very difficult to bring to poor people, so they are mostly for rich households. For poor people, we find that what works really well is adaptive social protection, so using the safety nets in countries to increase coverage, to increase the amounts being transferred to people when they are affected. So it's really using the infrastructure of social protection to do post-disaster transfers. But by doing that, we move the risk from the people to governments, which means that governments will need themselves tools to manage this risk. And these are the small green bubbles that you see in this figure. Governments need reserve funds for small shocks, government insurance and contingent finance for bigger ones, and international aid like the crisis response window of IDA for bigger disasters. Only if you have all of that together you will be able to manage shocks, and we really stress the existence of big synergies. So if you're a poor individual in a country, and your country makes market insurance available, maybe you won't be able to access it because insurance is too expensive for you. But if the middle class in the country is covered, it means that after a disaster, your government won't have to help the middle class because they have market insurance. And government will be able to focus resources on poor people with no access to insurance, for instance. So even if market insurance covers only the middle class, it doesn't mean it's not a good thing for poor people. And that's the case for all of these things here. If you're rich, you also have an interest to have poor people in your country covered by adaptive social protection, because otherwise you might lead your country toward a big crisis that will be very costly to fix. So this is really like a package that we need to implement in countries, and we should not look too much at just one silver bullet, but at this entire thing. The last point I want to make in this presentation is that we create for the 117 countries country profiles, like the one you see on your screen for Malawi here, where we're looking at about 10 different policies, and we're looking at how these different policies can avoid asset losses in the country and avoid well-being losses in the country. So what you find in these profiles is, so here, for instance, for one policy that is typical of disaster risk management, reducing the exposure of poor people so that total exposure is reduced by 5%. So it's about building dikes, doing good land use planning, but doing that so that it protects poor people. We assess the benefits of doing that in terms of asset losses and in terms of well-being losses. And here we calculate only the benefits of doing that, because the costs depend on whether you want to use dikes or land use planning and so on. But we see this type of information as a way to engage with policymakers in a country, saying, like in Malawi, for instance, reducing exposure by 5% can deliver benefits for like 23 million per year. What kind of policies, what kind of tools, what kind of projects can reduce exposure by 5% for a cost that is lower than 23 million per year. So it's really not, the aim is not to tell countries what to do, it's to engage in a conversation about the different options. And in these profiles, you find things which are typical of disaster risk management, like reducing exposure, but also things which are not, like increasing social protection and social coverage of poor people in the country. In Malawi, it might be the most efficient way of reducing disaster losses. It's not typical disaster risk management, but it's still something that would build the resilience of the population. And even if it doesn't change the asset losses, it would make the population better able to cope with those asset losses and make them more resilient. So again, here the goal is to bring around the table people working on social protection, which might not see themselves as doing disaster risk management, but what they are doing could be very useful for disaster risk management. We also show that better post-disaster support could generate a lot of benefits, and here the goal is really when people are doing social protection in Malawi, if we can convince them not only to do a social protection system that's good for reduced poverty, but a social protection system that also can help with post-disaster support, well, the benefits would be even bigger. So this is what we're trying to do at GFDR, trying to make sure when somebody is doing a development project, the development project is designed in a way that also contributes to resilience. So I won't go into all of the details of that. We are looking at early warning systems and many other things. Just to conclude, I want to say that we have the results of the analysis in the 117 countries, and we just published an appendix book with the results and the country profiles for the 117 countries that I hope can be useful to discuss disaster risk management in countries. The way we see this work contributing to operations is, as I was saying, not telling countries what to do because it never works, but have something that can help bring around the table the right people. So not only the people who see themselves as doing risk management, but also people working on transport and social protection and financial inclusion and so on. And also to try, because we assess all of the policies together, trying to move from a very piecemeal approach where we're doing one project here and one project there to something which is more a disaster risk management strategy that really builds on the complementarity between the different instruments that we have. So I will stop there, looking forward to your comments. Just to conclude, I just want to say that the next steps for us is to bring that at the country level, and we have already projects going on in Sri Lanka, Bolivia, and the Philippines, trying to implement this tool within the country, sometimes at the subnational level, to test whether this is a useful instrument. So we might know more in like 12 months about how well it works, but I really hope that this can be a useful engagement tool in different countries. Thank you very much again for taking the time to listen to me. I've been a bit longer than I planned, sorry about that. Looking forward to your questions now. Thank you.
Okay, thank you very much, Stephane, for that very comprehensive and good presentation. I really like this new way of measuring the impact on natural disasters on the poor. This like a different kind of new metric, which also changes how action can and should be taken on the ground to benefit the well-being on the poor. We have now 25 minutes left for a Q&A session. Before we start with that, just some technical details. I would like to invite you to ask your questions in the chat window, and then I can give you the floor, and then please unmute yourself when you speak and ask your question, and Stephane can respond. Also, when you speak, please identify yourself with your name and affiliation. We had already one question about the number of countries. It's 117 countries, if I understood correctly. Then we have a question from Martin Rokitsky. Mr. Rokitsky, please unmute. So Mr. Rokitsky is asking, thank you, Stephane. Have you considered Panagy, adaptive cycle thinking, and threshold considerations in the analysis? Frankly, I'm not sure what that is, Stephane.
So, I mean, there are different. So let me check and I understand your question. One of the issue with this using this like poverty metrics to think about disasters is that there are a lot of threshold effects. So when we're looking at the impact of disasters on poverty, for instance, we're looking at how many people are getting like below the global poverty line, so the $190 per day poverty line that the World Bank is using. And we're well aware that by using this type of indicators, we're missing also a lot of what's going on. So for instance, if somebody is already in extreme poverty before the disaster, then this indicator doesn't show any change if this person is affected. So we have a lot of this threshold effect, and one question is whether these threshold effects are real. So if you have poverty trap, for instance, having somebody falling below the poverty trap line means really something, because then this person will be trapped, versus some thresholds which might be just some threshold we use for measurements, but not representing real things. What we're doing at the moment is to work on panel data to better understand the impact of disasters on poverty, and especially trying to look at the thresholds, at whether there is a threshold below which people don't fall in poverty and recover, but they fall in poverty and stay in poverty longer. Temporary poverty that might be created by a shock, and a long-term chronic poverty that might be created by a shock. And I have to say, there are very few results on that at the moment, and that's why we're working on it, because it's absolutely fundamental to better understand if we're talking about short-term shocks or shocks with permanent consequences. So we're working on that in a few countries, and we hope to have a better understanding on that, like in a few months. At the moment, it's difficult to give an answer which is not only like one case study here or there. I don't know if it answers the question, but that's why I understood.
Okay, thank you very much. And we have another question from Nilambari Falki. Please unmute yourself.
Yeah, hello?
Yes, please.
Yeah, so I was wondering if you have any examples from India, because while listening to the talk, I recently submitted my doctoral thesis, and I have arrived at very similar results from my study. And it also, I've also concluded that it directs the results directed me to a more, moving more towards safety nets and, moving the risks from the people to the government. So I was wondering if you have done any work in Sundarban as well.
Thank you, Stephane.
So yes, so first, India is one of the 117 countries that we cover. So we have results there, even though India is an obvious candidate to do subnational work, right? Because the country is so big that using like aggregated results might be just hiding what's really going on. We have been doing a few things in India. First, the model was first developed using the flood in Mumbai in 2005. So we have an application at the city level in Mumbai. We also did some work on floods and poverty in India. So this is not published yet, but what we think we find, but we're still working on that, is that the impact of floods on poverty has been decreasing over time in a measurable way in India, and we're wondering if the public works program could be one of the explanations why we see a much smaller impact now than we see for 10 years ago. So that's something that we keep working on. And finally, in the review of the different instruments that people have implemented, India is a case where crop insurance have been scaled up and is now a very significant instruments for farmers to manage risk. So while in many countries crop insurance remains very, very small, and you find a few pilots, they might work well, but they're very, very small. In India, this kind of instruments reach a significant level. So we review these different tools because we feel they are good examples for other countries. Now, I mean, moving forward, I hope that we can work at the subnational level in India, especially compare different states and how states vary in terms of what are the priorities in different places.
Okay, and just one thing about the crop insurance scaling up you mentioned. Did you observe that at any rural place, or like in a village or something?
Well, the coverage is now like touching like millions and millions of people. So yes, it covers rural areas.
Oh, because in my study, when I tried to look at it, whether the people I talked to were covered by crop insurance, and sadly, people from I don't know if maybe is about the caste system and about people from diverse religious backgrounds. Several of the households did not have access to the crop insurance, so I am a little bit skeptical to say that that people in all over India are benefiting from crop insurance.
No, I did not say that. I mean, I said that the scheme is big. I mean, it's more than 10 million people, which in India is a tiny fraction of the total population. But it's still a very different animal than the pilots that we have seen in Africa, for instance, which can cover sometimes like 1,000 people and no more. So the India case shows that you can go to scale. Of course, it doesn't cover a large fraction of the population in India. So I'm not surprised by your results, but I don't think they contradict our point, which is just that you can cover a significant share of your population with these type of tools.
Yeah, I think these country case studies are really interesting to learn more. We have one question from Jean-Pierre Tosi on Afghanistan. Can you please unmute? Jean-Pierre?
Can you hear me now?
Yes, okay. Please.
Well, the question is there. I mean, I understand that concentrating the risk will make life easier to any, I would say, risk manager. But definitely there are some situations where it's quite difficult to foresee, let's say, to transfer the risk to the government somehow. Sorry. So my question is, did you had any consideration on this situation on your study, on your work, and if so, do you have any input in such specific context, I would say?
So I understand that you're talking about places with low capacity and maybe conflict and fragility where it's not so easy to get the governments to act, right?
Well, I'm not used to say so, but in this specific case for the seminar, I will mention straightforward where the problem is, and it is well known, I would say, that Afghanistan is a very corrupted context.
So there are maybe two quick answers to your point. The first one is, as we were trying to develop this measure of resilience, we thought, we need to bring the capacity and maybe conflict areas in the picture. And then we realized that in our analysis, we don't use an indicator for fragility or capacity, but the consequence of being a place with low capacity or conflict is visible through the other things we're looking at. For instance, access to finance or coverage by social protection, which are almost inexistent in places with very weak governments and conflict. So the first point is, in our analysis, even though we don't take into account explicitly the problem of capacity and conflict, we look at the consequences of low capacity and conflict through the indicators that we're looking at. So we find that places with very low resilience are very often places with weak governments, corruption, and conflicts, consistently with what we expected. In terms of what to do and priorities, it brings me to one thing which is a limit of our analysis, and I've been talking a lot about it since we published this book, which is the interaction between what's going on at the community level and what's going on at the regional or national level. In places where the government cannot act and where people don't have these national level tools, we find that the community plays a bigger role. And the big question in those places is, how can we use the community and create tools that complement what the community can do without replacing what the community can do? And the experience suggests that the community systems work very well, much better, when the community is overwhelmed, basically, and the local solidarity doesn't work because everybody is affected at the same time. The community can turn toward some other tools. An example is how in Ethiopia, the Productive Safety Net program is combining national level safety nets with targeting at the individual level that is done by the community. So the way it works is the government selects the communities which are the most affected, and the resources are transferred to the communities, but then the community itself decides who within the community will receive the support because they have better understanding and knowledge about who is affected the most. And this type of example where we combine the knowledge of the community with the national level can help overwhelm some of the obstacles. Of course, it's always very difficult to act in places like that, but this combination can really help. With one caveat, in some places, the community can have exclusion, can be gender-based, can be ethnicity or religious-based, and we have to be very careful as we use communities to deliver support at the individual level that some people are not excluded for those reasons. So no easy answer on this question, of course, but this is something that we discuss at length, and we try to highlight a few things which have been working well. For instance, public works program in Côte d'Ivoire after the civil conflict worked relatively well in spite of very low capacity and a conflict context. So we have examples of success even in those very difficult places.
Thank you. We have another question from Manish from the STC Daily office. It's actually, I think, more like a comment and a possible application of the metric. Manish, please unmute. Yes, Manish? Okay. So Manish writes, we are engaging in governments at the subnational level and are in the process of helping them implement their action plans on climate change. This information will help in articulating the policy significance of the work we do. I think that's also important, and this good metric that also considers the specific needs of the poor can also help to highlight the benefits of the pro-poor work. Thank you. Are there
just one point on that? So I don't know if we will manage to get started on a sub-national level in India, but if the case, and if we start doing that, would be maybe interesting to be in touch on that case.
Great. Manish, I hope you heard that. A question regarding the applicability, maybe you say you worked primarily on the national level, but this can also be applied in a specific city, for instance, right? Did you do such case studies already, or is this planned?
No, so to develop the ideas and the models, we started from an actual case study, which is 2005 flood in Mumbai. We did that because I've been working on Mumbai for a long time, and we did series of household surveys in the city to try to understand the impact of the shock and the coping mechanisms that people have used. So the model was really developed on that case study. And right now we're trying to do a similar application in Accra in Ghana. So we will do more of these city level cases, but I have to say that working on the case of Accra is significantly more complicated. For instance, they had these huge floods in 2015, but there is no map of the areas that had been flooded. So it's sometimes when you start working on some cases, it's really surprising how little data we have on past events. So even if we go and so we will be going in 2 weeks to do a household survey to understand what happened and the consequences, but we cannot use a map of flooded areas to try to guide us in the selection of area to survey. So a lot of challenges at the city level, but I think we'll keep working on that, because a lot of the actions that can reduce risks will be taken at the city level, especially the land use planning and also choice of the localization of transport infrastructure and schools and hospitals and so on. All of that is guiding city developments and might be the most efficient tool to guide development in safe places. So we really have to engage at city level. This is clearly a priority for us.
Thank you. Are there other questions from the audience at this point? One question which came to my mind, the resilience policy package that you mentioned seems to be lacking any measures of say urban planning or prevention or pure prevention measures that happened before the impact. Is that just not so visible, or what is your view there?
Yeah, so this might, so as I present this work, I realize that, I mean, if I had to do it again, I might do it slightly differently. This resilience package that we show is focusing on not on avoiding disasters and reducing risk, but on making the population better able to cope and recover. Mm-hmm. So we decided to leave out the risk reduction part to concentrate the figure on the other tools. One thing which we did not anticipate is that it gives a biased impression of what needs to happen. In practice, what we say in the book, but is not very clear in the presentation, is that see, my daughter starts to intervene. Is that disaster risk management needs to be built on two pillars. One pillar is reducing risk to avoid disasters, and the second pillar is making the population better able to cope when there is a disaster that we cannot avoid. And so what we're doing to reduce risk won't be enough, because if you think of developing countries, risk reduction won't be anywhere where it needs to be before like at least decades. These things will take time. So we really have not only to reduce risk, but also to make the population more resilient. And at the same time, working only on making the population resilient won't work, because all of the tools we describe, like safety nets and insurance, they can manage residual risk, but they cannot manage a risk that would be increasing forever. So this is very, very clear from our work, that we really need to work on these two pillars. In communication terms, I fully agree with you that the way we present the work, because we decided to focus on the resilience part, might give the wrong impression. So probably we'll just adjust the way we present that work in the future.
Okay, I think that's a very good point, because that may be as important as strengthening the resilience in terms of networks, social capabilities, and so on. Okay, thank you very much. I think it's also time for your daughter. I would like briefly to ask everybody in the call to just use the chat window and write down your name and affiliation, so that we know a bit who has actually been in the call. This helps us to plan the next calls. We plan another set of webinars in April and May. Please also join the CC&E network, so that you are always updated on the next dates and webinars. And I would like to thank warmly Stephane Hallegate for this very perfect presentation on a very important topic. And I think this is a research issue, and also a issue for practitioners that only grows over the next years in importance. So thank you very much. And with that, I would like to close the webinar.
Thank you very much for your time and the invitation. It was a pleasure.
Thank you very much. Goodbye.
Bye.